اور کسی بلیڈنگ ڈس آرڈر کے لیے امپورٹنٹ ہے. وائٹامن ای کس چیز کے لیے زیادہ تر ہم دیتے ہیں؟ وائٹامن ای یہ سارے ایک بات یاد رکھیں، یہ اینٹی آکسیڈنٹ بھی ہے نا یہ چیزیں. تو وائٹامن ای کس کے لیے ہے؟
سر مسلز ویکنس کے لیے.
اور
اور ویژن کے لیے بھی ہے سر.
جی
سر ویژن سائٹ کے لیے بھی ہے، ویژن پرابلم بھی اس سے ہوتی ہے نا.
وائٹامن ای کی بات کر رہا ہوں. نہیں وہ تو
سر
یہ
یہ
سارے وائٹامن.
مسلز اینڈ نرو ڈیمیج کے لیے موسٹلی یوز کرتے ہیں وائٹامن ای.
اور فیمل کو دیتے ہیں جس میں فریکوینٹلی ابارشن ہوتے ہیں. تو یہ اس کے وائٹامن کے بلیڈنگ ڈس آرڈر کے لیے. اور یہ بیری بیری جو ہے، اور یہ آپٹک نیورائٹس میں ہم ویٹا سکس جسے نام کمرشل نام سے اویلیبل ہے وائٹامن ڈی سکس، جو ہم اینٹی ٹوبرکولر دیتے ہیں. تو وائٹامن بی سکس کو ایڈ کرتے ہیں تاکہ وہ اینٹی ٹوبرکولر میڈیسن رائٹس وہ کافی اینٹی ٹوبرکولر میڈیسن جو ہے بیوٹال جو ہے زیادہ تر اس کے ہم جب بھی اینٹی ٹوبرکل، کیونکہ ہمارے ہاں ٹی بی بہت زیادہ ہے، بھی اینٹی ٹوبرکولر کسی بھی پیشنٹ کو دیتے ہیں تو اس میں ہم کلر ویژن اس پیشنٹ کو ایکسپلین کرتے ہیں. لیکن بدقسمتی سے ہمارے ہاں یہ چیز نہیں ہے. بہت سے پیشنٹ میرے خیال میں، بہت سے سارے افرمالوجسٹ میں بہت سے پیشنٹ جو اینٹی ٹوبرکولر پہ ہیں، وائٹامن سکس نہ دینے پر وہ لوگ جو ہے آپٹک نیورائٹس کے ساتھ پریزنٹ کر چکے ہیں اور ڈیکریز ویژن، پرماننٹ ویژن لاس کے ساتھ پریزنٹ ہو چکے ہیں. تو یہ چیزیں اپنے ذہن میں رکھیں اور وائٹامنس کو ایز اے براڈ سینس میں لے لیں. ٹھیک ہے نا. وی ول پروسیڈ وائٹامن اے ڈیفیشینسی. ایکچولی وائٹامنس کا رولز کیا ہے اس کا؟ وائٹامن ہے کیا چیز؟ وائٹامن از این آرگینک مالیکولز ہے، ایک ریلیٹڈ سیٹ آف مالیکولز جو اس کے ساتھ آرگینک چیز جو ہے. دیٹ از این اسینشیل مائکرو نیوٹریٹ. ایک ہوتے ہیں میکرو، ایک ہوتے ہیں مائکرو نیوٹریٹ. I am not going for discussion of nutrients. Nutritional is another subject. I think I will invite someone nutritionalist to give lecture on nutrition. That is an essential. یہ word جو ہے یہ بہت زیادہ important ہے. یہ ہم استعمال کرتے ہیں essential micronutrient جس کے بغیر گزارا نہیں ہے. That an organism need in small quantities for the proper functioning of its metabolism. Now, metabolism is needed for epithelium, other connective tissue, collagens, different structure of the body will go for metabolism and they will need these vitamins for proper metabolism. Now, vitamins are divided in two groups: water solubles. Water soluble vitamins are B complex and C vitamin. Fat soluble vitamin A, D, E, and K. Unlike water soluble vitamins that need regular replacement in the body, fat soluble vitamins are stored in the liver and fatty tissue and are eliminated. میں نے یہ وائیوے میں بعض لوگوں سے پوچھا تھا کہ what do you mean by elimination and eradication. تو یہ ورڈز انگلش ورڈز ہیں جو ہمارے لیے تھوڑا سا مشکل ہے، لیکن ان ورڈز کو اچھی طریقے پراپر اس پہ پلیس پہ استعمال کیا کریں. eliminated much more slowly than water soluble vitamins. Now vitamin A deficiency we will go in this way. Now in introduction to epidemiology. Why we here in Peshawar, Professor Aman Safi has done a survey and presented a paper in international conferences about vitamin A deficiency, documented films. We, from Pico site, we prepare films of children having vitamin A deficiency. And these children, some were from highly educated families. So he presented this vitamin A deficiency in international conferences. Now, we will discuss what were the strength, how many patients were that will be coming in the next slide. Vitamin A deficiency was reported in early 1800. Now, how it was identified in 1913. It is the leading cause of preventable childhood blindness and mortality. ये याद रखें, preventable है. Blindness and mortality. ये blindness और mortality सिर्फ यहाँ पे नहीं, not only here for vitamin A deficiency. Whenever there is blindness, there will be more mortality. The studies show that blind people die early as compared to others because of the blindness. Why? They give the reason that blindness, blind people are exposed to multiple traumas. So these mentally and both physically, these will lead to early mortality. Blindness and mortality are related things. ये याद रखें ये चीज. About 0.25 millions and 55.5 malnourished children in the developing world go blind each year. Now it is not a small number. Around half of whom die within a year are becoming blind. जो मान नरिश हैं या तो मर जाते हैं या वो एज की बात कर रहा हूँ, बात की बात ना, जो मैंने ब्लाइंड और मर्टिलिटी रखे हैं, वो ब्लाइंडनेस के साथ जो कंटिन्यू रख लेते हैं, तो उसकी अर्ली मर्टिलिटी ये यहाँ पे डिफिशियंसी की वजह से जो बॉडी टिश्यू नॉट प्रॉपरली मेटाबोलाइज their providing energy for the tissue, so they will go for if they are not going to die, they will become blind. In the World Health Organization, because of this statistic, listed Pakistan as a country with severe subclinical vitamin A deficiency. Pakistan has an under 5 mortality of 101 per thousand, which is more than India. This survey was, I think, in 2000. Bangladesh and Nepal. The proportion of children under 5 years old suffering from vitamin A is almost similar to children in India. Here, Pakistan की बात कर रहे हैं. And clinical cases of vitamin A have been reported from this country, and active vitamin A distribution program have been in place for a long time. The first two sentences are from the previous slide, but here a distribution program, that is special thing, a distribution program has been placed for a long time. You here Professor Dawood and Muhammad Dawood and Professor Aman Safi has start fighting for introducing vitamin A in nutrients other like ghee, like other things in Pakistan. They fight for 20 years. After 20 years producing these videos, these pictures of vitamin A deficiency children, then they recognize and the world has here introduced vitamins in different nutritional things, like particularly ghee. They were fighting to be fortified ghee with vitamin A for 20 years, after 20 years. So it takes time to uh, implement things here in Pakistan. A total of 154 children, this is the study, 15 from 0 to 15 year of age were reported to have been suffering from xerostomia from KPK of Pakistan. Out of 154 children, 123 children, 79%, were aged 6 years and below. So this is the study that in these 99 children were male and this, but you can see these studies blinding xerophthalmia. How much it was? 78%. This was the report presented by Professor Aman and Professor Muhammad Dawood. Other countries. Now we are going for the why vitamin A is important because of the suffering of this alarming statistic. But nowadays, at present, after this almost 20 years from 2000 to now 2020, so now we improve a lot. Even nowadays, some people ophthalmology, even including me, we see patients when you see the conjunctiva, the slit lamp, you will see some patient from the far periphery in rural area coming to you with irritation. They may be having allergic conjunctivitis. Inflamed eye is very difficult to recognize vitamin A deficiency, but some children will present white eyes and you will see the vitamin A deficiency in their eyes. So some now up to now, but the number is less as compared to the past because of improving of, and therefore in Islam, if you see in Islam, they give importance to the sadaqah, that you will do sadaqah and this thing because people will get benefit of that sadaqah, that will be you will be providing meats, rice, different things. So people will be not going for nourishment. Again, this is the same picture statistic. It is now the common thing first I mentioned, but it is common in poor countries but rarely seen in more developed, almost eliminated in 1940. जो modern countries है. The prevalence, why? Because they included vitamin A in everything. The prevalence of night blindness due to vitamin A is also high among pregnant women. In many developing countries, vitamin A deficiency also contributes to maternal mortality and other poor outcomes in pregnancy and lactation. Now, you can see here pregnant women, because here in rural area they will be taking only with bread, this pakode and chutney and nothing else proper. They will be not taking, they will be having cows, they will be having buffaloes, but their milk will be sent to shops for earning money. They will be not using this milk, even in rural area, in spite of having this thing. But again, we suffering from this, and these pregnant female are facing in future life with great difficulties in their respiratory system because they will need epithelium, skin disorders, and even bone disorders, tiredness, early tiredness. Their facial feature will tell you that these females are males are malnourished. Nectolopia, night blindness, is one of the first symptom of vitamin. Some books has mentioned these signs. We can't say it is wrong because if it is documented and people has accepted it, so but again night blindness is a symptom, it is, but the signs of night blindness are also present in some fundus. Therefore they are using signs of vitamin A deficiency. So don't think that they are wrong and we are also wrong. No, both are right. Investigation and research proved that vitamin A is responsible for blindness and high mortality in children, maternal mortality, poor outcome in pregnancy and lactation. And as I told you that what is poor outcome? Poor outcome is that the mother is also malnourished, the child will be malnourished, their brain development also be affected, their IQ will be also affected, their pregnancy stages, labor stages will be also problematic, and the death ratio from the delivery that pregnancy related is also more. So if they are good with physical health is good, they will be not facing this type of problem. So we are also low IQ people. Globally, 65% of all children ages 6 to 59 months receive two doses of vitamin A in 2013, fully protecting them against vitamin A deficiency. Vitamin A is a term for large number. Now it is its metabolism. Now we are discussing. Vitamin A is a term for large number of related compounds. These three things are important in vitamin A. The retinol, retinic acid. These all compounds are consistent. These three. So these three numbers, in some books it is mentioned only these two, retinic acid and retinol. But these three components are related to vitamin A. Retinoid, these are called retinoids. The vitamin A, so sometime we will be using these words, sometime we will be using these words, and this word. These are unrelated to, but these are the contents. Vitamin A forms found in fruit and vegetable is called provitamin. Carotenoid, beta carotenoid, beta cryptoxanthin, which can be converted into retinol in the blood. So body will convert to retinol. Vitamin A is a fat soluble. We already know that. Generally referred to as a group of compounds that has the biological activity of all-strong retinol, the alcohol form of vitamin A. Many carotenoids, including beta-carotene, are termed provitamins. Why provitamin A? Because they can be enzymatically converted to vitamin A. So now you know what is provitamin. So this is only the words. Adults and teenagers 6 to 15 milligrams. This is the dose that is required of beta carotene, the equivalent of how much it is? 10,000 to 25,000 units of vitamin A activity per day. Children 3 to 6 milligram of beta carotene, the equivalent of 5,000 to 10,000 units of vitamin A activity per day. So they will be needing this. Retinol is a type of vitamin A found in animal products like liver, kidney, eggs, and dairy products. Now this is the how it's go proper entry. So liver, eggs, butter, milk, fortified cereals, जो दालें हैं, रेटिनॉल ईस्टर इसके साथ अब ये रेटिनॉल विटामिन ए कन्वर्ट हो रहे हैं, ये इंटेस्टाइनल ल्यूमन में है। कैरेट, स्पिनच, ये सारी चीज़ें कैरोटेनॉइड्स में आ जाते हैं, ये रेटिनॉल्स की फॉर्म में आ जाते हैं, और फिर ये इंटर हो जाते हैं एंटेरोसाइट्स में, इंटेरोसाइट्स बन जाता है इंटेस्टाइन में। तो ये चीज़ें फिर सारे कन्वर्ट हो रहे हैं, क्योंकि we have more slides, so I am not going in detail, but it is a detail. Nothing else has been left. So it is the detail. So this we know now that this change to retinol, these are directly that can be changed into this way, or they can change into retinol and retinol. A and O ईस्टर फॉर्म में चेंज हो जाते हैं, और ये ईस्टर फॉर्म ब्लड में पहुंच जाते हैं और लीवर में स्टोर होते हैं। ये लीवर है आप लोगों का, तो ब्लड से यहाँ पे जब इस ज़्यादा मकदार आ जाती है, वी हैव मोर vitamins, then some will go to store in the liver, and from liver off and on, when there is deficiency of this vitamin in blood, so they will be coming from the liver and they will be approaching directly like this or from the store to the target cells. This is the other things we already discussed in the first semester, these things. Now, vitamin A is provided from the food either as a preform, as we know that, or as provitamin A carotenoid. दोनों form में we have got this. Retinol ester are hydrolyzed by pancreatic and intestinal enzyme. So we need normal pancreas. Some people who operate on their pancreas will be having deficiency. So for that, we will be giving direct vitamins or directly into the blood injection form are also available. So we will be taking care of this. Some people intestinal portion because it's in small intestine. Some people go for surgery and remove some of the part of their intestine. So we will be taking care of that patient as well. Now, free retinol is taken up by the enterocytes. We are this is the discussion actually of the previous slides that we have seen. So all these things are discussed, whatever in the previous slide. This is again what chylomicron is. This is a milky plus micron small, a small fat globules composed of protein and lipid fat and are found in the blood and lymphatic fluid where they serve to transport fat from its port of entry in the intestine to liver and adipose. So this fat will be containing your vitamin A, this chylomicron. Through this way, we enter our vitamins A into our bodies. Vitamins A retinol fat soluble, we know that. Milk, egg, this is the sources. Carotenoid, dark green leafy vegetables. And the last one is here, that is 1 unit. Sometime we will ask like this. It is approximately 1 unit is equal to zero point 0.3 microgram retinol or 0.55 microgram of retinol palmitate and 0.6 microgram of beta carotene and 1.2 microgram of other provitamins. So this unit you see now, if you are talking about the unit of different things, if you are talking about 1 unit mango, so that will be in different meaning. If you are talking 1 unit or 10,000 units of grapes, so that will be different things, different international unit for these different things. 50 to 90% of ingested retinol absorbed through, you can see now, small intestine and transported to the liver store and retinol palmitate. Released into the blood as we saw there, stream when needed in the form of retinol with retinol binding protein RBP. This complex 1:1 combines with transthyretin. This retinol is removed from serum and utilized by the target tissue. 6 times provitamins will give one retinol. So if you take six, that will provide one. Ratio is like this. Serum level 200 microgram per liter. Daily requirements 180 to 450 microgram per day. Different for children as we mentioned in the previous slide. The excess amount stored in liver, we know that now. When vitamin A level in blood, liver stores maintain normal serum level. Whenever there is deficiency, this will come in front and liver will release this vitamin A. Both retinol and protein are needed for normal function. Now, from all these slides that we have mentioned, now as 1:1 ratio, we need protein for their transport and for the availability to the target tissue. Whenever there is now deficiencies of protein malnourishment, Kawashirkor, marasmus, Kawashirkor, so there will be also associated vitamin because protein will not be available to transport vitamin A. But if again protein is available and vitamin A is not available, again there will be nothing to transport. गाड़ियाँ खाली जाएंगी इन द बॉडी तो बॉडी में जो ट्रांसपोर्ट सिस्टम है वो तो अवेलेबल है लेकिन चीज़ नहीं अवेलेबल जो ले जाएं सवारियाँ नहीं है so these the thing that are dependent on each other. This is the picture that I have taken from physiology book that severely deficient, normal, subnormal stores, reduced serum level, epithelial metaplasia. What will be the adverse effect? Now, reduced serum level agar hai, so now there will be epithelium metaplasia. You know the metaplasia. What is metaplasia? Anybody?
Sir, change in cell shape.
Shape or
Yes,
both
sir.
shape, function, the cell will differentiate into another type of cells. So their function, all things will be disturbed. Or not only in shape, because if you say the word shape, because there is hypertrophy. In hypertrophy, your cells will also enlarge, the body tissue will enlarge. There are again hypertrophy, pathological hypertrophy or physiological hypertrophy. So in that your structure, shape of the cell will change. But here also the function is also changed. The there will be loss of function, proper function. So now epithelium will be defective, your respiratory system epithelium, your mouth epithelium, your intestinal epithelium, your genital organs epithelium. So wherever your conjunctival epithelium, wherever there is epithelium in the body, that will be affected. Remember, not only eye, vitamin A deficiency. So all this, because if there is respiratory epithelium defect, there will be repeated pneumonia, repeated respiratory infection, and infection will further deteriorate the nutrition of that child. That will be not eating, that will be not, there will be loss of appetite whenever there is repeated infection. Here in this part of the world, those children who get fewer repeated infection, we add in medicine vitamins to protect them from vitamin deficiencies. I write this to many children, this Vidalin M. There is both simple with M. M means minerals. So minerals are also included in this Vidalin syrup. And xerophthalmia and blindness. This is with the time. Reduce survival, anemia, and reduce growth. This is vitamin A status. In normal condition, liver will maintain normal serum level. This is here in Pakistan at present. I think there are two laboratories that check your vitamins. One is in Islamabad National Institute, and one is, I think, in Agahan at Karachi. There is no others at present, what I know. It may be there, but at present, there are, I think, only these two laboratories can check your blood level, serum level of vitamin A. I think these facilities are not available in Peshawar and other cities. But at present, I don't know. It may be available, but I don't know. Impaired dark adaptation and abnormal conjunctival epithelium differentiation generally begin when level is below 200. So early changes in this structure, 0.7 millimole, micromillimole per liter. Xerophthalmia will develop when level goes below this. It is good to remember these things because these are the end points. Serious if fat can develop before xerophthalmia develop. Now we can see that. Now, clinical classification. Why we got this classification? Because if you treat this 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 portion night blindness XN will be giving response when you at the same times when you give vitamin, and the structure, the severity will gradually increase. Now, if there are for long time, there will be more severe changes in your eyes. If it is for short time, then will be less changes in your eye. Now we come to the night blindness XN. Retinol is essential for the absorption of rhodopsin. We already, I think, Nudrat, yeah, which who discussed night blind, this visual changes with pigment epithelium and rod and cone. There was a lecture in first semester.
Yes,
That
sir.
was
Shafi ने discuss किया था.
so that was good. So now we know that this is important for rhodopsin. Affect children. I am not going for that cycle. Affect children sit in a secure corner, often unable to find their foods or toys. ये जो children है ये बड़े उसमें गोट में बैठ जाते हैं क्योंकि उनको नाइट में दिखाई नहीं देता. बस चिल्ड्रन जो है वो अ, दौड़ते हैं. दे कैन रन एट इन ए स्लाइड डार्क रूम. बट दिस चिल्ड्रन क्वाइटली बहुत ही खामोशी से बैठे होते हैं. स्टडीज शो के ये चिल्ड्रन जो है ये खेलते नहीं है रात को. Night blindness, even some congenital disorder of night blindness like retinitis pigmentosa and Gaucher disease, uh, different other types of disease. I will discuss, give you lecture on night blindness. So there are different disease that cause leads to permanent, reversible, and static night blindness. Now, night blindness X and lack of rhodopsin in the retinol photoreceptor rods, usually reversible in 48 hours with treatment. Other causes we know that retinitis onchocerciasis, essential congenital stationary night blind, fundus albicutatus, and others disease. White retinospix xerophthalmic fundus, ये आपको नजर पे है. हमने अभी तक कहीं पे क्योंकि हमारे जो पेशेंट हैं they come to with corneal scarring, corneal ulcer, and we are not able to see the fundus at early stages. But these are from the others book that they give like this type of pictures. But I didn't saw this type of picture in vitamin A deficient children. But it can be. Conjunctival cirrhosis now. A. Due to absence of goblet cells with decrease in mucin because goblet cells will be producing mucin and squamous metaplasia of conjunctival cuboidal epithelium. Often difficult to see, especially in inflamed eye. जो मैंने कहा था कि जो now they are coming with the allergic conjunctivitis or conjunctivitis, so it is very difficult to see this. Why exactly we don't know. Why inflammation subside these signs symptoms of vitamin, not symptoms but signs of vitamin A deficiency. Usually temporal, then inferior conjunctiva. Improve in 2 to 4 days with treatment. I will show you pictures. This is columnar epithelium, which is also present. And now there is metaplasia to squamous epithelium. You can see here they are changing. This is your normal, and this is changing too. Bitot spots. Appearance due to keratinization and secondary infection with gas forming chorion bacterium cirrhosis. ये याद रखें. ये गैस फॉर्मिंग बैक्टीरिया जो है, white or gray cheesy or foamy spot usually at the temporal conjunctiva. Why? We don't know exactly. Why not on the medial size? May take, there are different discussion for this, but the exact mechanism is not known. May take weeks or months to resolve with treatment, and some never resolve. You can see here conjunctival xerosis. Actually, what do you mean by xerosis?
Sir, dryness.
Dryness. Good. So you can see here there is, you can't see the reflex of tears. So this is also general dryness also, and conjunctival. You can see temporal side of this white deposit and white deposit on the conjunctiva. Now it is now clear dryness, conjunctival xerosis, the lines you can see here. So it needs special attention while when you are going to examine the children. Most of you are also uh, going for clinics and try to identify this and look for these things in children. When you are looking for these things, you will find. If you are not looking for this, you will be missing these signs. Now you can see the foams here. Few foams are here. This is your left eye, and you can see on temporal side the line. You can see here dryness. Now it is more prominent, and the pigmentation, you can see the brown pigmentation. This is black pigmentation. This is also association with these foam cells without spots. Now you can see more cheesy like without spots here, but here cornea is not involved. Now advanced conjunctival xerosis involving all of the bulbar conjunctiva, mild to moderate corneal xerosis, dry hazy appearance cornea. You can see the changes in cornea. Advanced vitamin A deficiency. This is called advanced vitamin A deficiency. Conjunctival xerosis, as we discussed the picture, I discuss here the same things. With treatment, we also know that with treatment, the active conjunctival xerosis and bitters was began to resolve within 2 to 5 days. Most will disappear within 2 weeks. The significant proportion of temporal lesion in shrunken form for months. Even they will be having normal level of vitamins A, but these things will remain. So needs early detection and early treatment. Advanced conjunctival xerosis involving all the bulb, mild to moderate corneal xerosis, dry hazy appearance. Now it is clearly visible, the cornea. This slide is just to show you the corneal physics. Now you can see the dryness, pigmented changes here. If I show you these slides or other slides, you will not only say that there is dryness, you can also see the pigmented changes, and the shining of the conjunctiva and cornea has been lost. Again here the same things, corneal xerosis and dry hazy appearance. Corneal xerosis. Changes begin early, long before they can be seen with naked eye. बहुत से क्योंकि epithelium involved है, so now if, you will be not able until and unless you examine these children on slit lamp. For early detection, you need slit lamp. Many children with night blindness without clinical evident conjunctival xerosis have superficial contact lesion of the inferior nasal cornea. Nasal cornea. Conjunctiva was temporal, this inferior nasal, stained with fluorescein. Early in the disease, the lesions are only visible through a slit lamp. As severity increases, punctate lesions spread upwards and the corneal stroma become edematous. The cornea develops xerosis, hazy lusterless, जो शाइनिंग है, जो रिफ्लेक्सेस है और ज़ाया हो जाती है. dry appearance near the inferior limbus. Thick keratinized plaque resembling bitter spots form on the corneal surface. With treatment, these plaques peel off, sometimes leaving a superficial erosion that quickly heals. Most treatment within 2 to 5 days, same as others. Cornea regaining its normal appearance in 1 to 2 weeks. Now this is fluorescein staining, punctate appearance. Diffuse haze of the corneal xerosis. Now you can see the cornea structure is also changing here. You can see the margin. This is now, it is visible on naked eye. This is also now, you can see this. Uh, I think we have in Pico slides of this, our patient who presented to us. We have a video of those patients who presented to ophthalmology unit. Corneal ulcers, and these are the keratomalacia and also less. Now cornea ulcer X3A, ulceration of less than one third of the cornea. ये भी आप लोगों को, क्योंकि now treatment will be different for these things. Ulceration B of one third or more of the cornea. It is likely that there are different mechanisms. Small, sharply demarcated ulcers, shallow or moderate deep, usually inferior nasal. B. Stromal necrosis, localized or generalized, often beneath an intact epithelium. Called, क्या कहते हैं इसको?
Keratomalacia.
Very good. जाग गए हैं थोड़े से. Ulceration keratomalacia indicates permanent destruction. ये याद रखें, permanent destruction है of a part of all the corneal, a part or all of the corneal stroma, resulting in permanent structural alteration, corneal opacity, and decreased vision or blindness. These mechanisms are not definitely understood, but is probably possibly due to an epithelial cyst that ruptures, or possibly due to eyelid trauma or an area of metaplasia, or is necrosis of corneal matrix, collagens, and mucopolysaccharides, usually without inflammation. But this is some explanation for this change. Corneal ulceration take 5-7 days to heal with scar. With treatment, ये याद रखें, vitamin A treatment. Formation providing that there is normal corneal left. X3A ulceration of less than one third of the cornea. The ulceration of ये चीजें, ये दोनों जो मैंने अलग लिखे हैं, ये आपने याद रखने हैं. अल्सर्स आर क्लासिकली राउंड, ये याद रखें, क्योंकि जो हमारे फंगल केराटाइटिस के जो अल्सर हैं या बैक्टीरिया के हैं, वो इस किस्म के अक्सर नहीं होते. वो पंक्टेट टाइप्स के होते हैं या फीदर्स लाइक, फीदर्स जो जानते हैं ना,
Yes, sir.
तो उस टाइप्स के या ग्राफिक्स टाइप्स के होते हैं, जो जियोग्राफिक टाइप अल्सर होते हैं. जिस तरह आप
Dendritic, sir.
डेंड्रेटिक्स भी होते हैं, बिल्कुल जिस तरह आपका हर्पीस सिम्प्लेक्स केराटाइटिस और डिजास्टर आ जाते हैं, और इवन ट्रकोमा के साथ भी आपके आ जाते हैं. So the surrounding cornea is generally xerotic but otherwise clear, look like a bacterial infection. Small peripheral single or multiple ulcers are present. They are usually deep but may be superficial. Superficial ulcer heal with little scarring, but deep ulcer go deep form of desmetocele. Desmetocele जानते हैं? What is desmetocele?
Sir, the edema of desmet.
और कोई बता दे. कोई और बताएं. इसकी क्या मीनिंग है? दिस नीड टू सी, ये बन जाए, नाउ दिस विल प्रोसीड टू दिस, so this meant to seal if there it pro it perforate and develop adherent locoma at periphery. Now ये मैं थोड़ा क्योंकि because this is a clinical presentation, now anybody 10 rupees who can tell us about this, what is, let's meant to see.
Thickening of curve in which the only remains displacement.
Oh, very good, शाबाश, आपको एक मार्क्स मिल गया है और 10 रुपीज भी मिल गए। 10 रुपीज तो अभी मैं दे नहीं सकता, एक मार्क मिल गया है आपको। तो ये है डेस्मेंट मेम्ब्रेन। जब आपके स्ट्रोमा, एपिथेलियम, स्ट्रोमा ये सारे मेल्ट हो जाए, अल्सर हो जाए, रिमूव हो जाए, then only layer will remain now behind is descent membrane, and behind descent membrane is your endothelium. Now this will bulge out. The pressure inside the eyeball will bulge this membrane, and this is too much resistance. ये याद रखें, जो हमारी डेस्मेंट मेम्ब्रेन है कार्निया, इसकी रेजिस्टेंस परफोरेशन के लिए बहुत स्ट्रांग है। तो ये बिकॉज ऑफ द अल्सरेशन, more ulcer will be there, more area will be exposed. Now this descent will bulge out and they will form like cyst. Therefore, it is called as metaphyseal. So it will end. There are chances to rupture, rupture of this membrane. When you see this type of desmetocele, we cover it with contact lenses to prevent perforation for emergency, and we prepare the patient for keratoplasty, corneal graft or conjunctival graft to prevent perforation. Okay. Now, what is adherent glaucoma? Adherent glaucoma is that set of the cornea. ये याद रखें। There is explanation in the next coming slide. ये याद रखें ये चीज। When there is perforation, your iris will come to block that perforation, and the whole cornea will now opacified at that portion. That will be blocked. So adherent with the complete corneal opacity will be developed. That will be called adherent glaucoma. Their opacity depend on the portion of the involvement of cornea. That may be superficial corneal opacity, there may be deep corneal opacity, there may be total corneal opacity. Whenever there is total corneal opacity, that will be called glaucoma with adherent or without adherent. X3H generally spare the central cornea and give good response to treatment. X3B usually result in perforation. Now we know the importance of this classification. Intraocular content loss of the globe. Treatment may save the other eye and the child life. Classical punch out peripheral xerophthalmic ulcer, ये आपका नजर आ रहा है? Can you see this?
Yes, sir.
So this is, I think nowadays this type of pictures in clinical side will not be visible to you or not be available to you. Now you can see here from the inferior portion, the vitamin A ulcer will start from the inferior portion of cornea and bitter spot on the temporal conjunctiva. Now you can see the fluorescein staining and lusterless of the cornea. Now corneal inflammation is also in white in vitamin A deficiency, and you can see the opacity, and you will see the depth of opacity which is there. And we have in Pico portable slit lamp. You can carry that slit lamp into the pediatric unit as well. Anybody? मैंने बहुत से उसको कैंप में लेके गया था, जो मेरे साथ है आई कैंप में, उसने वो पोर्टेबल स्लिट लैम्प देखा होगा। किसने देखा है? हाँ असद, کسی نے وہ سلیٹ لیمپ دیکھا ہے؟ پورٹیبل سلیٹ لیمپ پیکو میں اویلیبل ہے. آپ کو آواز سنائی دے
نو
رہا
سر نہیں دیکھو.
کیوں نہیں دیکھے؟ تو آپ لوگ دیکھنا چاہتے نہیں ہے. جو چیزیں دیکھنا چاہتے ہیں وہ تو آپ لوگ دیکھ لیتے ہیں، لیکن جو چیزیں پیکو میں دیکھنے کی ضرورت ہے وہ تو آپ لوگ نہیں، ہمارے پاس ہیں. اگر یہ حالات ٹھیک ہو جائیں، جب بھی آپ آ جائیں سبت سے پوچھے کہ ہمیں پورٹیبل سلیٹ لیمپ دکھا دیں. Severe. Now there is severe involvement of the cornea. Corneal scar healed sequelae. The changes of corneal ulcer are there are stages: Ebola, Macular, and Leucoma. Oh, یہ کون آیا ہے ابھی؟ یہ دیکھیں نا، یہ بندہ آپ اس کو دیکھ رہے ہیں جو ابھی آیا ہے، پتہ چل گیا ہے کتنا انٹرسٹڈ ہے. I am not allowing at this point to him. جان گئے اس کو؟ Now what will be this corneal ulcer? This is superficial. That is less than 1/3 thickness کی بات کر رہا ہوں ابھی. diameter کی بات نہیں. thickness کے how deep it is. It may be superficial, just involving the stroma interior portion. Then leucoma, macula will be involving the stroma, but not the whole cornea. Leucoma will, this opacity will involve the whole cornea. With or without staphylomas and phthisis bulbi. Staphylomas جانتے ہیں؟ What is staphylomas?
Sir, outpouching of the uvea anteriorly. Sir, anteriorly بھی ہو سکتا ہے.
Normal protrusion of uvea.
کوئی اور اس کو امپروو کر لے. اسٹیفیلوما میں اکثر یہ کویشچن کرتا ہوں اسٹوڈنٹ سے کہ what is the difference وائیوا میں، what is the difference between keratoconus and staphylomas?
سر کیراٹوکونس اس کا ہے، کارنیا کا ہے، اور یہ جو ہے یوویا کا ہے اسٹیفیلوما. سر
کیوں یہ کارنیا کا نہیں ہو سکتا؟ دا سیم. اسی طرح میں پوچھتا ہوں کیوں یہ کارنیا کا نہیں ہو سکتا اسٹیفیلوما؟ یوویل ٹیشو کون کون سے ہیں؟ ذرا یوویل ٹیشو کے نام لے لیں.
سر آئرس سیلری باڈی،
آئرس سیلیری باڈی اور کورائڈ. تو ٹیشو ہے تو آئرس نہیں ہے آپ کا یوویل ٹیشو؟
یس سر. تو اصل میں اسٹیفیلوما اکثر بلیک کلر کا ہوتا ہے. اور
پوچھا ہے کہ کلر کیا ہوتا ہے، میں نے اسٹیفیلوما کا پوچھا ہے. دا سیم آنسر آر کمنگ. جس طرح میں ابھی پوچھ رہا ہوں تو سیم آنسر آف کینڈیڈیٹس آر کمنگ کہ یہ چیز ہوتا ہے. پھر میں پوچھتا ہوں کہ نہیں اسٹیفیلوما اور کیراٹوکونس میں مجھے فرق بتائیں. وہ کہتے ہیں کہ بلجنگ آف دا کارنیا. تو میں کہتا ہوں کہ بالکل ٹھیک ہے، لیکن اسٹیفیلوما پھر کیا ہے؟ تو اینی باڈی، بیکاز اس پہ میں تھوڑا سا ٹائم لوں گا آپ لوگوں کا کہ آپ لوگ اس پہ سوچیں.
سر اگر انٹیریئر اسٹیفیلوما ہو جائے تو اس میں کارنیا انوالو ہو جاتا ہے، لیکن وہ پیچھے سے جو ہے نا یوویا ضرور جو ہے اس کو پش آؤٹ کر لیتا ہے. لیکن کیراٹوکونس میں جو ہے اس سے مطلب یوویا جو ہے نا اس کے ساتھ مطلب پش آؤٹ نہیں کرتا اس کو، وہ اس کے اپنے تھیننگ کی وجہ سے جو ہے وہ پروٹروڈ آؤٹ ہو جاتا ہے.
اچھا، اسٹیفیلوما کے ٹائپس کیا ہیں؟
2 انٹیریئر اور پوسٹیریئر.
یہ کس نے نیٹ میں دیکھ لیا اب؟
نہیں سر نیٹ میں نہیں، یہ تو ہمیں پتا.
اچھا، کیونکہ ہمیں تو پتہ نہیں چلتا. ویڈیو آپ لوگوں نے دیکھی ہے کہ آج کل جو اسٹوڈینٹس تھے وہ اپنے کمپیوٹر پہ سارے آنسر لگا لیتے ہیں اور پھر جواب دیتے ہیں.
Yes.
اچھا، تو ٹھیک ہے، جہاں سے بھی آپ نے سیکھنا ہے سیکھ لیں. اسٹیفیلوما یہ یاد رکھیں، اسٹیفیلوما از بلجنگ. کلیرا کی بھی ہو سکتی ہے، کارنیا کے بھی. اس کے ساتھ یہ ورڈ ضرور ایڈ کیا کرے، ایسوسیٹڈ ود کورائڈل ٹیشو یا यूवियल टिश्यू इन सिंपल वर्ड्स, जहाँ पे भी है वो टिश्यू इसके साथ। तो यूवियल टिश्यू एसोसी बल्जिंग ऑफ स्क्लेरा भी हो सकती है, बल्जिंग ऑफ कार्निया एसोसिएटेड विद यूवियल टिश्यू। इसके साथ ये सिंपल वर्ड्स हैं जो आपके याद होने चाहिए, और अपना कंसेप्ट भी क्लियर कर ले कि व्हाट इज मीन केराटोकोनस। अभी पोस्टीरियर स्टेफेलोमा जो है वो पोस्टीरियर फंडस में होता है, उसमें मैं फिर पूछता हूँ कि इसमें रेटिना है या नहीं। तो जब पोस्टीरियर फंडस स्टेफेलोमा डेवलप हो जाता है, then there will be bulging because there will be no support for the retina. तो फिर पीछे जो है वो बल्जिंग एसोसिएटेड ये सारे आपके यूवियल टिश्यू भी आ जाते हैं और रेटिना भी पुश कर लेते हैं। और उसकी जो अभी पोस्टीरियर स्टेफेलोमा अगर बहुत ज़्यादा है, एंड दे विल आल्सो अफेक्ट योर रिफ्रैक्टिव एरर, क्योंकि आई एक्सियल लेंथ अगर वो सेंटर में है तो आपके एक्सियल लेंथ बढ़ जाएगी, और अगर एक्सियल लेंथ बढ़ जाए देन देयर विल बी मायोपिक चेंजेस। तो ये याद रखिए कि इसके साथ जब हम पूछते हैं कि ये तो आपका जनरल वो है नॉलेज और कंसेप्ट है कि देयर विल बी नो सपोर्ट फॉर द रेटिना। उस दिन भी किसी ने पूछा था कि रेटिनोपैथी ऑफ प्रीमेच्योरिटी में ये मायोपिया क्यों होता है, उसमें मैंने कहा था कि इसमें बिकॉज ऑफ द मास स्ट्रक्चर हमें क्लियरली पता नहीं है, लेकिन लेंस की वजह से भी हो सकती है उसमें, और उसमें पोस्टीरियर सेगमेंट की वजह से भी हो सकती है, एंटीरियर सेगमेंट की, क्योंकि मास स्ट्रक्चर है तो उसकी वजह से भी हो सकते हैं। तो ये स्टेफेलोमा और इसका थोड़ा सा लेकोमा नेबुला कार्नियल स्कारिंग, इसका हम पूछते हैं। अगर पेशेंट नहीं है कार्नियल ओपेसिटी वाले पेशेंट, हम हो सकते हैं स्लिट लैम्प पे बैठा दे आपको, जिस तरह ये पेशेंट है। तो ये पेशेंट मैं अभी इस स्लाइड पे तो मैं नहीं कह सकता कि नाउ इट इज नेबुला, तो कह सकता हूँ कि नेबुला है, मैकुला भी हो सकता है, लेकिन लोकोमा है या नहीं है आई डोंट नो, बिकॉज नाउ आई विल नीड स्लिट लैम्प टू सी द डेप्थ ऑफ दिस ओपेसिटी। ये वो स्क्लेराइज हो चुके हैं, यू कैन सी द ब्लड वेसल्स। और अभी मुझे ये प्यूपल जो है ये थोड़ा सा यहाँ पे obscured है, यहाँ we can't see properly, but स्लिट लैम्प के साथ we will be able to see this कि ये क्या आयरस अटैच है या नहीं है। जब आयरस अटैच है then we will call it adherent glaucoma। ये देखिए आपके कार्नियल सरफेस, ये आपकी एपिथेलियम लॉस कंजक्टिवल इन्फ्लेमेशन, और ये आपके परफोरेशन, और ये आपके इन्फेक्शन, और ये आपका डेस्मेटोसील, आपका पूरा कार्निया जो है वो मेल्ट हो चुका है, और आपका आयरस जो है नाउ इट इज कमिंग आउट। स्टेफेलोमा कार्नियल वस्कुलराइजेशन, ये आपका सारे टिश्यू जो है बल्ज कर चुके हैं यहाँ पर। यहाँ पे कार्नियल स्कारिंग की वजह से नाउ इट्स वस्कुलराइज्ड एंड फ्लैट। On this picture it is very difficult for you to say it is flat, but I have seen this patient, therefore I can see this, it is flat। प्रॉब्लम, अभी विटामिन ए में हमारे साथ प्रॉब्लम क्या है?